Assalamualaikum and a very good day I wish to all of you. Welcome to our forum for today. As well, we know our topic is about private healthcare versus public healthcare, which enable you to think about the topic that we had highlight, and we are trying to discuss the issues and sharing beneficial and interesting ideas which will be delivered by our guests. Today, we will highlight a topic that is quite interesting to be discussed. I'm ensure that everyone has our own opinion and joke with this topic. Before we proceed to our forum, I would like to introduce our panelists today. Our first panelist is Puan Fatin as a retired nurse. How are you today?
Good and glad to be here this morning.
Next to her is our specially panel to Cik Farayuni an as an influencer. Also, we have Datin Emilia as a healthcare professional. Before we start our forum in details, let me explain about our topic today. Healthcare system refers to the system that provides medical service and support to the people, which includes hospital, clinic, doctors, nurse, and other who work together to keep people healthy. When choosing between private or public healthcare, it is important to carefully consider various factors. These factors to consider in health decision making include our personal needs, financial capacity, and preference. Without wasting time, let's the opinion on our first invited.
Thank you to Ms. Moderator. In my opinion, I prefer public healthcare. This is because for me, the B40 group who are experiencing some financial problems, this is especially true for Malaysian who have recently retired as the price of medical care typically goes out with age. This cost of healthcare service in public system is typically subsidies are entirely covered by the government. This helps make healthcare more affordable for everyone and minimize financial barrier to access. This will reduce the patient burden, especially in this unstable economic era. That's all. I pass back to our moderator. Thank you.
Thank you for Fatih. From your explanation, you just said earlier that public healthcare offer a lower cost compared to the private healthcare. Now, let's move on to Cik Farayuni. What is your opinion?
Thank you to Mrs. Moderator. So based on today's topic, I can directly state that costs in recent years for private treatment in Malaysia have been increased for several reasons. This is mostly due to the increased inpatient moving from private hospitals to public hospitals. This result, the private hospital is loss of income. Also, due to the cost of medicine and new advanced equipment introduced according to international standards, private hospitals face difficulties in financing these expenses. Advanced equipment available in private hospital is more make it easy, or we can say more accurate, to detect disease before treatment season. Before doctor give a treatment season. In addition, in private hospital, we also can get quick treatment, and we also can choose the specialist that we want for the treatment. So that's all.
Okay, thank you, Cik Farayuni. That was a great point to be said. As you mentioned that even though the cost offers in private healthcare is higher compared to the public healthcare, it is worth with the treatment began. What can you say, Datin Emilia?
Thank you, Miss Moderator. I am Emilia Paul. My matrix number is E23828891 as healthcare professional. I am honored to stand before you. Today, I want to share here some of my points about public healthcare for improving the well-being of individuals and communities. In the world where health challenges are constantly challenges evolving, my mission is to provide compassionate care, promote preventive measures, and empower patients to take control of their own health. I totally agree with your opinion that public healthcare is more better than private healthcare. It is because public healthcare systems can promote effective resources allocation by implementing some of the strategy. Public healthcare system often provide comprehensive coverage including preventive care, primary health care, specialists, consultation, hospitalization, and emergency services. This ensures that individuals receive necessary healthcare services without worrying about financial constraints. By implementing this strategy, public healthcare system can promote effective, comprehensive coverage that maximize health outcomes and addresses the specific needs of population. Thank you so much. To you back, Miss Moderator.
Okay, thank you very much for the sharing, Datin Emilia. As you said that public healthcare also offers effective resource allocation that promote preventive measure to the patient. So, Puan Fateh, anything you want to add to clarify more detail about our topic today?
Thank you, Ms. Moderator. In addition, doctors in Malaysia are generally knowledgeable, professional, and fluent in English. Before they can start practicing, doctors are required to complete 3 years of service in public hospital across the country, ensuring there is adequate coverage for the general population. Foreign doctors are also encouraged to share their expertise in Malaysia. These foreign doctors are expected to be highly qualified and tend to work in public hospital as position in private practice are hard to come by and in high demand.
Okay, thank you, Puan Fateh. You just mentioned that about the expertise of healthcare play an important role in public healthcare because of highly qualified compared to the private hospital. And then now we move to our last two panelists, Farah and Datin, Cik Farah Ayuni and Datin Emilia. Anything both of you want to support your opinion earlier?
Thank you, Mrs. Moderator. The quality of doctors, surgeons, and other medical staff does not differ between public and private hospitals. Medical professionals in private hospitals are being trained and educated in modern best practice in healthcare. Most of them having studies medical at universities abroad. So they have more experience and knowledge that can be gained abroad before starting a career in a private hospital. This is convince the patient to get a treatment from the doctor at private hospital. This is because, of course, the patient will choose the best doctor to get the treatment.
Okay, thank you, Cik Farah Ayuni, for the sharing. In your point just now, you did mention that in private hospital that the staff or nurse were trained to treat the patient because of their experience. How about you, Datin Emilia?
Thank you, Miss Moderator. Moreover, I think that public healthcare is more to reduce profit motive by preventive care and health promotion is crucial for public healthcare systems. Public healthcare is not driven by profit motives, unlike private healthcare. This means that decisions regarding healthcare services and resource allocation are often based on medical needs rather than financial considerations. Public healthcare system prioritize the well-being of patients and the overall of health overall health of the population. So, the choice between public and private healthcare depends on individual preferences and the specific healthcare system in place. That's all. Thank you.
Thank you to all the panelists for informative and interesting talk. Before we end our forum today, I would like to open up a few moments for Q&A questions so audience can ask our panelists directly if there are any doubt or question that run in mind. We have two questions. Question one is, how do you believe that government subsidization or coverage of healthcare service in public system?
In my opinion, the government subsidies or coverage of healthcare service in public system aim to alleviate financial burdens, ensuring more accessible healthcare for various demographics. This approach helps mitigate the impact of rising medical costs, particularly for vulnerable groups like B40 and retirees. Thank you.
Okay, we move to the next question. From your knowledge, what is the difference between public healthcare versus private healthcare? Cik Farhayuni.
Thank you for a good question. For me, public healthcare refer to a system in which the government is responsible for providing healthcare service to its citizens. The primary objective of public healthcare is to ensure that all individuals within a society uh, have access to affordable and quality medical care, regardless of their financial status. This system is often funded through uh, tax, taxation or other government revenue source. While the private healthcare refer to a system in which healthcare services are provided by privately owned entities, such as private hospital, clinic, and healthcare providers. In contrast to public healthcare, private healthcare is typically funded through private means such as insurance premium, out-of-pocket payments, or employer-sponsored healthcare plans. That's all. I'm passing back to the Mrs. Moderator.
Okay, finally, we have come to end part of our discussion. I would like to express my gratitude to our panelists again for the informative and interesting idea and also audience for the active participation. To sum up our discussion, the decision between public or private healthcare depends on individual preference, financial capabilities, and societal values. By that, individual can compare the available option which can help them make a right decision that best suits their requirements. Hopefully, this discussion will be beneficial to everyone. Thank you for your attention. Assalamualaikum warahmatullahi wabarakatuh.